Hello, good people. Welcome, welcome. We're going to talk about applied existential therapy. I've been teaching theories for over 20 years now, theories and techniques, and I'm very interested in how we actually apply the different theories with clients, with actual clients. And there's a lot, and we need to know them all. There's an adage in the field of counseling that the longer you're in the field, the more of a humanist you become. But I firmly believe, and existential therapy actually is a humanistic therapy, but I do think we need to understand the applied essence of all the theories, and that actually makes us better helping professionals overall, and perhaps even better humanists. With applied existential, just first of all, know that counselors, y'all are my heart and my heroes, clients as well. So I think this is the highest honor and art to be a counselor, to meet with people and with the intention of helping. I believe it's just the highest occupation. Very noble. So I'm grateful for all of y'all. Anxiety. And I'm just extracting a few things from existential therapy. There's a lot of contributors to this. You know, we can talk about Frankl, we can talk about Bugental, we can talk about Yalom, among many others. And it's certainly the therapy is informed by existential philosophy. But what we want to look at is what can we actually apply? And I'm just going to pick out a few things that I've found helpful. Sorry if it's a little bit jumbled, but anxiety, clearly, no, people are complex and issues are complex. Never simplify. That does such harm to clients when we simplify. But anxiety can be when somebody is experiencing that, and I believe it is the number one mental health issue in the US today. Anxiety can be a signal that we're not living our most authentic self. And so it could also be genetic. You know, the parents, the grandparents could have had issues with anxiety. So again, we need to look at all the different angles and think about this systemically. But one thing that is helpful if a client is experiencing anxiety is to talk about, yeah, we definitely want to teach coping skills, mindfulness, relaxation, breathing. We want to look at, perhaps genetic predisposition, and maybe there's a need for medicine. But let's also look at what your life looks like right now. And are you living according to your highest values and your authentic self? Okay, because it's so easy when we grow up to kind of live according to the ideals in which we were raised. And maybe we are studying something in school that's really not a good fit for us, but we felt kind of compelled to do that from our parents or guardians or teachers or in society. Even TV shows can cause a dramatic increase in the number of students applying for college majors and so forth. So there can be all kind of reasons people get into different college majors and study different occupations that are not truly matched to who they are. This can be true for relationships. Okay, you got into a relationship and maybe not for the best reasons. Anxiety could be a signal that, hey, this isn't a good relationship for you. This isn't a good career for you. This isn't a good college major for you. So it's worth just checking out. As anxiety as a symbol, it's symbolizing something. It's indicating something that we need to take a close look at. Another really helpful aspect of applied existential therapy is using immediacy in the session. And what I mean by that is asking somebody, hey, and Yalom is really good at this. If you want to watch tapes with Yalom, is to look at and say, in our professional relationship, I'm wondering how you're experiencing our interactions. Okay, because what we're wanting to do with that type of question or statement, where we're being very immediate, and that's hard to do, okay, because ultimately what we're asking folks to do is to think about what's going on within the counselor-client relationship, and let's work on within the counselor-client relationship, our professional relationship, not being passive, not being aggressive, but moving towards being assertive, using I statements, I feel because, for instance, so that we can work on being more authentic and assertive within our professional counseling relationship, so that then the client can learn these skills, develop confidence, because it requires practice. This isn't a cathartic experience. It requires practice to be assertive in relationships. Just as we probably learn to be passive and learn to be aggressive, we want to teach how to be assertive. And this then goes to the macrocosm, the microcosm of the counselor-client relationship. We can take these skills of assertiveness and authenticity into the macrocosm of work, how we relate to people at work, how we relate to our partners, our friends, our siblings, our kids. So that's one of the beautiful things of existential therapy, is paying attention to what's happening within the relationship. You know, Irvin Yalom in group demonstrations, within the very first group session after they've introduced, he'll say, hey, I suspect we've already started making judgments about each other. I'm wondering if we could start talking about those. Now, I know some of you are like, whoa, way too soon. I don't think that could happen. You know, maybe it's not safe or whatever. But that's an example of, if we really work on paying attention to what's going on within the counselor-client relationship, we can build the authenticity and assertiveness and take it to the outside relationships. And relationships are so important for our mental health. Okay. Another thing that, and I put the Cartman drama triangle here just as also a part of this authenticity. You know, we've all been victims in various assorted ways, and sometimes heinous and egregious ways. But we can find sometimes that we can get stuck in these roles and we're not authentic. You know, if we're constantly persecuting or perhaps playing the victim. There's a difference between being victimized and playing the victim, and rescuing, because rescuing is another aspect, because it silently sends a message to people that you're not capable. Now, that is a game we can play, but do we need to advocate for others? Do we need to advocate for our clients, for societal change? Absolutely. And so a lot of this happens to do with intention. What is our intention? And how can we move to be more authentic and more assertive and less passive and aggressive? So I sometimes find drawing this out for clients, and collaboratively, we're doing this collaboratively. It's sometimes nice to have a whiteboard on the wall that you can do this together. Can be a nice way to really pay attention to building this skill, improving the counselor-client relationship, which then can help improve all the other relationships you have. And it looks like I'm about out of time. So I'm going to end here. There's a lot more we could talk about with existential therapy. I am grateful to all of y'all. If this was helpful, please like, share, subscribe, and please comment to let me know what else you would like to see. All right, until the next video, take good care.